I'd like to take just a moment to go over a few housekeeping items. Now, on your screen, you should be seeing a Connecture title slide. If you're having any problems viewing the webinar, please send an email to marketing@connecture.com and we will try to assist you. Next, this presentation may contain forward-looking statements. Forward-looking statements involve risks, uncertainties, and assumptions that could cause actual results to differ from statements made on today's call. For more information, please visit the Investors section of our corporate website at connecture.com. Now I'd like to explain today's process for asking questions. Due to the number of attendees we have on today's call, participant lines have been muted. If you would like to submit a question at any time, click the orange arrow in the upper right corner of your screen to open the questions box. Questions will be answered at the end of the presentation. If you do not see the orange arrow, you can email your questions directly to marketing@connecture.com. Should we run out of time for Q&A, any questions that were not submitted or addressed during the webinar will be personally answered via email after the presentation. At this time, I'd like to go ahead and introduce our speakers for today. First up is Don Formanek. Don Formanek is a Director of Product Management with an emphasis on the Medicare market segment. In this role, his primary focus is to ensure that Connecture's Medicare products meet our clients' current and future needs, as well as adhering to all CMS regulations. Next, we have Christian Parisi, and Christian is a Director of Strategic Accounts here at Connecture. Over the past 6 years, Christian has worked directly with Connecture's Medicare clients on both the implementation side of the house as well as account management. So now that you have some background on our speakers, let's get started.
Hello. Christian and I are delighted to join you for the conclusion of Connecture's two-part series on how to have a successful Medicare annual enrollment period. So as you know, AEP 2016 is rapidly approaching. So what we're going to do is share with you how the next generation of our products are designed to better meet your goals. We've done a lot of research with consumers, including usability testing and surveys, and we've also paid attention to trends in the market. As a result, our newest products have a fresh and consistent look and even better usability. Now, everything that we do at Connecture is really focused on helping you achieve your goals, and that's why we partner to understand your needs so that we can deliver products to address those. To help with customer acquisition, you can improve the direct-to-customer site with a Plan Compare user experience upgrade, which we will share with you. And you can equip your sales force with Plan Compare Agent app and Professional Plan Compare Plus, both of which are tools to help your sales force increase acquisition as well. In terms of retention, we're proud to introduce our retention module. And to help you with cost savings, you're all quite aware that Connecture products are designed to decrease your IT and administrative cost. And last is compliance, perhaps nobody's favorite, but obviously a predecessor for all of the other activities. So we'll show you how the professional tools that I mentioned help in this regard. So again, the acquisition, retention, cost savings, and compliance goals will be addressed today by giving you a view of Plan Compare User Experience Upgrade, our Agent app, our Professional Plan Compare Plus, ancillary products, and our retention module. Now I'm going to turn it over to Christian to talk about Plan Compare User Experience Upgrade.
Thanks, Don, and good afternoon, everyone. Over the last recent months, I've had the opportunity to speak to clients regarding these new products that Don just mentioned, so I'm excited to be able to share more information with you today. Before I walk everyone through the first preview of the Plan Compare User Experience Upgrade, I wanted to cover these two objectives here. First is the improved user experience. It's been based on extensive user testing as well as design utilizing best-in-class web interface technologies. We can now offer a unified design of the interface across all our lines of business. And we also offer an optimized viewing experience based on the user's device. Second is the ability to drive revenue from this improved user experience through new features such as guided help, shopping cart, registration promotion, and also something that we're planning for a future release, which would be physician search, that is planned for another release projected at a 2017 AEP plan year. Towards the bottom of the slide here, you see some more information containing checks and X's. I wanted to provide a quick overview of what that means, as you'll be seeing that with a couple of our other products and feature descriptions later in the webinar. This particular product, the Plan Compare User Experience Upgrade, will be available for this coming AEP in our consumer-facing versions. And that comes in two particular versions, single carrier as well as a multi-carrier. We are planning for an agent-facing or professional version in a subsequent plan year. Here's that preview I mentioned just now. This is a preview of the new interface. You'll likely notice we've updated the look and feel to be more intuitive and modern with an increased site usability factor. We've incorporated design technology which now provides an optimal viewing experience to the user, all while continuing to meet the shopping experience expectations of consumers and Medicare beneficiaries that will be using the site. I do also want to mention that we will continue to offer the capability to configure the Plan Compare User Experience Upgrade with the existing client-facing admin tools so that clients can continue to configure color, branding, and other page-level configurations that you guys are accustomed to today. Here's a snapshot of the beginning of the guided help, a new prominent feature of the new user experience. If I could focus your attention to the left-hand side of the screen, you'll see a Help Me Choose button. This is the portion of the new experience that we believe will provide an enhanced flow to assist the beneficiary with selecting the best plan that meets their preferences. Line of thinking is that the guided help feature is intended to provide a more efficient means to the beneficiary by asking them a few short questions with the goal of providing them a list of plan offerings PDP plan. Okay, that's what they're in the market for. They would select the I only want drug coverage radio button. And the line of thinking here is that when we get to the point in the available plan options in the service area that they've selected, they would only see those PDP offerings because that is what they are shopping for. The new user experience upgrade will continue to support the Medicare plan offerings and Medicare supplement plan offerings that you would expect. You can see here in the image from left to right a listing of those types of plan offerings: MAPD, PDP, MA only, and Medicare supplement plan offerings. We'll take a look at what this entails on the next slide. Okay, illustrated here you see our new redesigned plan list page. You can get a sense of the layout here with those plan offerings that I had mentioned. Each respective plan type has its own tab. And you can see here that key information such as potential drug coverage, premiums for the respective plan offerings, star ratings, and potential ancillary products are prominently displayed throughout the layout. Now the beneficiary is able to compare plans at a high level, or they can click on the view plan details if they wanted to drill down further and get a better sense of the plan benefits specific to that plan offering. One item of note here for Medicare supplement offerings is that we have enhanced the guarantee question guarantee issue question and has been redesigned for a better ease of use. I had mentioned comparing plans, and so what you see here is the enhanced comparative shopping experience, whereby multiple plans can be selected and compared side by side. Each plan benefit that differs is highlighted, which we believe makes comparative shopping even easier for the beneficiary. If I could direct your attention towards the top, you can see that the Add to Cart buttons are prominently displayed. On the next page, I'll delve a bit more into this new feature. So the shopping cart is one of the new prominent features of the user experience upgrade. If you can think conceptually here, it is a concept that we are familiar with other well-known commerce sites. In the illustration here, you can see that the beneficiary has selected a MAPD plan with the respective premium prominently displayed on the right-hand side. And a dental ancillary product or rider is also available here, and that can be seen as listed in the shopping cart. A beneficiary can make changes as so desired as they're contemplating what they are about to enroll in. They can either make changes to the products that are in the shopping cart, or they can remove them. You can see at the bottom, the Enroll button is prominently displayed. And so we wanted to give the beneficiary a way to really consider what they're about to enroll in, the products that they're about to enroll in, as well as the pricing, so that we can minimize any potential enrollment fallout after they decide to enroll in these products. The final new feature of the user experience upgrade that I'd like to discuss is what we refer to as registration promotion. This particular feature provides an opportunity to encourage the beneficiary to register and save their information. Now you may ask, why do we want to do that? Well, perhaps the beneficiary is not quite ready to proceed with the enrollment. They've done their shopping, but for whatever reason, they want to either pause and further consider, speak to somebody, or come back at a later time. This will allow them to resume where they left off. For those multi-carrier exchange clients, this would allow for capturing the beneficiary's information up front before the user exits to the respective carrier site to complete the enrollment. There's also a tie-in here to realize potential lead generation capabilities. The idea being, if this information can be captured, it would position you for a follow-up experience with a prospective member.
Great.
I'll hand this over back to Don now.
Thanks, Christian. So most of you are familiar with mobile field enrollment. That's our Medicare enrollment app for the iPad. But with this next generation of the product, we're really expanding our capabilities beyond enrollment, and that's why we've renamed it to Plan Compare Agent App. So we know that you want to eliminate paper because paper is costly and it takes time to process, which doesn't really coincide with CMS regulations for speedy processing. So we want paper to go away. We're also starting to hear a lot of interest from carriers that they're hearing that their brokers are out there getting tablet apps from competitors, and they don't want to be left behind in terms of not being easy enough for brokers to sell their plans. It's something that we're just starting to hear in the market now. So Agent App, like mobile field enrollment before it, is a native iPad application that allows agents and brokers to electronically enroll beneficiaries in Medicare plans even when they're offline. This is intended for brokers and is available for individual carriers, currently not available for multi-carrier exchanges. So what we're trying to do today is to be sure and articulate for you how these features support your goals. So under the perhaps the most important one for you is increasing sales by your agents and brokers. And so before we take a look at some pictures, we'll just cover what those benefits are, the features that support that benefit. And that includes that it's a native iPad app that's keeping your agents productive out in the field. New this year is offline quoting, which includes details and benefit comparisons. Also new this year is Medicare Supplement and riders. When it comes to reducing your cost of enrollment operations, that's of course something that we strive to do, and that happens not just because it's offline, but you also get all those standard types of things like form field validation that reduce the number of errors that you get in processing. And Book of Business can also help reduce your cost of enrollment operations because it gives the agent information about the status of an enrollment rather than having to call and check in with you. And then finally, supporting compliance. That's actually a very key feature for the agent app. So that is accomplished through things like the e-signature. And new this year is scope of appointment, obviously a required form. You can really encourage compliance by having it available for the agent integrated within this app. As before, your information that you make updates is automatically updated for the users. And new this year is the ability to have a news feature that also appears on the homepage of the site. And last, just as with our other products, but a little bit more so, is the ability to control agent access and limit the types of plans and whether or not they get access to the app. So the first thing you're going to notice is the clean new interface for the agent app. At first glance, those key features are the same. That's not to say that the functionality is all the same, but really we're just trying to keep it simple for users. That's part of what an iPad app is all about. So you see there the key three features: the Book of Business, aka the list of profiles or client profiles that the broker is serving, the resource library, which we'll talk a little bit more about, and start a consultation. So as we continue here, as if we had tapped on Start a Consultation, we see that the favorite features from mobile field enrollment are still there. Things like the import existing contact. So that, of course, is the integration with the iPad's address book, and that allows information to be pre-filled here, and to some extent it also pre-fills into the enrollment form. New this year is Medicare Supplement, as we discussed. So that's why you see the streamlined Medicare Supplement questions on the bottom half of this image. And as Christian mentioned earlier, we are streamlining the guaranteed issue question as well. So this is a view of what that could look like for a broker. Next is our scope of appointment. That's been an eagerly awaited new feature for a lot of carriers. And now we have it integrated into the sales process to really ensure compliance, which is what you see at the top, this reminder right on the profile screen when they're first getting started. Hey, did you complete an SOA before you're engaging with this customer? So there are two options. On the left, you see the option to email the scope of appointment in advance, which is very similar to the way it works in Professional Plan Compare Plus. And on the right, that option led to this page, which is a scope of appointment that works offline that can be completed, including a physical signature, by the beneficiary. So obviously that makes sense when you have kind of the emergency scope of appointment process where there was not an ability to get started 48 hours in advance. The resource library eliminates those costs and hassles of updating all your paper sales materials, and it ensures that your sales force is always using the latest version. So same functionality as in the past, but a nice fresh new look and easier organization. So as I mentioned, quoting now includes both benefit details and comparisons. And you can also see in this image that Medicare Supplement and Riders are both part of the interface now. So Medicare Supplement you see in the upper right-hand corner is one of the plan tabs available, plan type tabs. And the riders are listed with each plan so that as you enter, as a carrier provides us with the riders that they provide and they let us know which plans can buy those, we display that, and that can help with making a decision about which plan to enroll in. So tied to that is our plan comparisons. So plan benefit detail is now included. Previously we only had premium. And so now we have the comparisons as well, and that will allow your agents to more actively use this tool to complete all of their sales needs. Offline enrollment continues. The part that people love the most, especially Medicare beneficiaries, is the ability to e-sign with their fingertip or a stylus. We've been told that that actually makes them feel more engaged in the process and more comfortable that they are a part of that process. We're also looking forward to automated confirmations that will eliminate the need for follow-ups by the consumer or the broker. And last, we have a quick glance at our enrollment list, which is now more appropriately named the Book of Business. And as part of that, it links to much more information. So from each of these names of beneficiaries, you're able to link into their profile, which includes important information like their scope of appointment and enrollment status, along with other profile information that you're accustomed to seeing in our other products. All right. So that is Plan Compare Agent app, currently available for iPad. Next, we have Professional Plan Compare Plus. So you're likely familiar with Professional Plan Compare already, which allows brokers and call center agents to access saved consumer profiles. But Professional Plan Compare Plus offers everything in Professional Plan Compare, plus a whole lot more. So you obviously know that you can grow your business by helping your brokers grow their business. And of course, you want to make your call center as efficient as possible. That's why Professional Plan Compare Plus helps your reps and your brokers boost productivity while they build stronger customer relationships to increase conversion rates. And all of this is done while following an end-to-end compliant workflow. Again, to cover the features within the context of the benefits and what it is that you're trying to achieve. First up, in terms of increasing sales and revenue by giving your agents and reps the right tools, we have a metrics dashboard and opportunities report, both of which we'll look at the metrics dashboard and discuss the opportunities report. The ability to send quotes, comparisons, and enrollment links. In terms of improving your workflow process and productivity, we have a scope of appointment, very similar to what you just saw with the app, and a task dashboard. And for proactively managing contacts so that they can continue up to close every sale, we have rich notes history and the ability to have a sales contact such as an authorized representative. So let's take a look at that agent metrics dashboard. This is intended to give key sales metrics that are going to motivate your staff. So that first chart on the left can show year-over-year completed enrollments, and that can really motivate somebody to say, okay, I'm behind where I was last year, I need to catch up, or I'm ahead of where I was last year, and I want to make sure I stay that way. Other types of information that we currently have available would be the enrollment by plan type, so they can focus in on those areas that are either the corporate goals or highest commission, and the ability to view where sales are at in the sales process. So are they getting their completion rate up high? Another way that we have metrics is in a drill down opportunities report. So in the opportunities report, they're able to say, okay, I want to see all the people who are in a partial enrollment because those are going to be really easy to follow up on and close the sale. And I want to see those for MAPD or MedSup. Say MedSup might have the highest commission, or you might be motivating your reps to focus on that. So people can go in and versus the historic model where all the information is in there, but you have to dig for it. Now they're able to really actionable or turn it into an actionable list. So they can access those particular criteria and then move forward with those sales. The paperless scope of appointment is represented here. So obviously, as Connecture helping you move to an offline mode, we are emphasizing an email approach where the consumer can send that the broker can send an email to the consumer can fill out their portion of the scope of appointment form online, and then later the agent can go in and fill out their portion as well. So as you might have noticed that it's the second tab in the process. So it's really our way of making sure it's integrated into the process so that people can remain compliant. And at the same time, we're streamlining it and making it as simple as possible for people to adhere to those rules. So everybody's aware of a sales situation where it's ending not with a closed sale, but with somebody saying, you know what, I need to think about it, or I want to see something in writing, which is actually more prevalent, I think, in the senior market. So it used to be that you had to write something down or find some other means of keeping track of that. But now this tool allows the ability to send out a quote or an enrollment form if they're actually ready to enroll, but for whatever reason don't want to do it on the phone. So this allows that conversation to continue rather than just being kind of a dead-end conversation. It provides that senior what they want to see in writing, and it also ties the agent ID to that enrollment so that the agent will get commission if the consumer decides to enroll on their own. Next, we have a picture of our notes and tasks. So I mentioned briefly a task dashboard earlier, and the way this works is that within each profile page, within any page that's tied to a profile actually, which is much more broad, the agent is able to create notes and tasks. Really, any kind of note that they want to create will be, they can just enter it wherever they are without navigating to a certain page. That'll automatically go into the profile history with a date stamp and the agent's identifier. And then they're also able to create tasks for themselves. So if they know that they want to follow up on a certain date, they can go ahead and enter that information there. We have little usability features like being able to select your particular date rather than having to look at a calendar, but it also has that level of flexibility. So this is really tied to a task dashboard. And the task dashboard basically is a way for the agent to see all of their tasks. They don't have to go look up a particular customer and identify what tasks are next for that customer, although they can do that. But more importantly, they're able to have the task dashboard as the main place that they look at in the Professional Plan Compare Plus tool. And that way, each day or every time that they have a free moment, they can go look at their task dashboard and see, hey, what do I need to do next? And that way they can keep those sales moving forward. And a last quick glimpse here is our rich notes history. We have just 3 samples here we have incomplete tasks to be followed up on at the top. We have some notes in the middle and a profile history at the bottom. So basically this, we create automated notes as well when information is changed or certain activities are taken. We also create automated notes so that you don't have to guess, especially if something goes wrong with a customer. You have a documentation everywhere of what's happened. So at this point, we get to have some fun and engage in a quick survey. As I mentioned before, we are really all about understanding your needs and delivering on those. So what we'd like to do now is to offer you the opportunity to give us some feedback. All right, so you should see in front of you right now a survey question that allows you to pick up to 3 features that you would like to see in Professional Plan Compare Plus in the future. So please select, I'll go ahead and explain what each of these are, but we're going to look for you to pick up to 3 features that you find valuable. So the first one is pre-written agent emails, and you can think of this as a customized communications tool. You want to be able to support your people in being able to send out communications quickly, but you also need them to be compliant. So this is a way for those pre-written agent emails to be something that you would approve of, but not be completely standardized. So that you can relate to that customer and what you talked about. The next is tasks for call centers, and that is so that in the call center environment, those tasks can be handled not just by the agent who created the task, but by whichever agent is available. So that really makes sense for a lot of call centers where there's not a lot of shared, where everything is shared. And there aren't agent-owned relationships with customers. Online forms includes an example of permission to call. It's converting the paper forms that you have today into online versions, obviously cutting down on paper. Next is the appointment scheduler, and that is allowing your agents to schedule appointments and for consumers to confirm or cancel those appointments. And finally is agent hierarchy, and that is mapping the relationship between agents and agencies and field marketing organizations, which can allow more reporting. So go ahead and vote now for up to 3 features that you would find valuable as part of Professional Plan Compare Plus. All right. Looks like we still have a few votes coming in. Seems like some people are having a hard time picking which 3. Okay. Oh, people are still voting. I think we're good now. All right, we'll go ahead and close that poll and take a look at the results. So what we see is that online forms, such as permission to call, is the clear top favored item, followed by pre-written agent emails to allow compliant communications. And then tied would be tasks for call centers and an appointment scheduler. All right. I just want to let you guys know that we'll also have another survey at the end of today's webinar that will allow you to vote on new products for the future. All right. So at this point, we're going to let Christian continue with a discussion of retention module and ancillary products.
Yeah, let's talk about the retention module, what that is, and what that can entail for a carrier. So in my current role, I've had the opportunity to meet and speak with clients, and I've had a fair amount of opportunity and exposure to hear from carriers and how they've stated how important the concept of retention is. As a means to help solve that particular business problem, we have designed what we refer to as the retention module, which is a combination of our products and services. Simply put, it consists of a plan compare site with what we call preloaded beneficiary information, as well as options to expedite the shopping and enrollment experience, which I'll speak to shortly. At the bottom again, you can see that we offer both a consumer-facing version as well as an agent-facing version of the retention module. So the goal is that expedited shopping experience and to be able to retain current members. Well, how do we do that? I had mentioned the preloaded beneficiary information. And what exactly is that? So you as carriers have a lot of rich information about their existing membership base, such as demographic information for members, as well as their prescription drug history via claims. And so what we can do is take that rich information and make it available both to the Medicare beneficiary in a consumer version or a customer service / call center agent in our agent-facing version. And so by utilizing that type of beneficiary-specific information, we believe that we can offer up a more personalized experience that will help that beneficiary or the agent assisting the beneficiary with expediting their shopping and enrollment needs. We also have the capability to be able to preload that information, such as name and address, into the potential enrollment form, and I'll speak to that a little bit in a subsequent slide. The point being, by doing small things like that, we can optimize the experience for both the member and the agent, as I mentioned, that may be assisting that member. Next slide, please, Don. I want to drill down a bit more on the concept of the preloaded information, because I think that things such as an existing member's history of drug claims can be an important thing, especially when shopping for a health plan. So what you see here is the drug list that a member or agent would have access to see upon visiting the retention module. And so as a member, I am taking these 4 drugs, and it is automatically populated to the retention module for me to do a couple of things. A, I can review and make sure it's still accurate. And if it's not, or if I've had a change in dosage or frequency, I can make that change right away. And I don't have to go through the time of having to look up drugs, even though there is a drug search lookup, but this is my prescription, set of prescriptions. And if there has been a greater change, such as the fact that I may not be taking Ambien anymore, or if I am taking a new drug, those types of removals or additions can be done. From an agent perspective, it can be seen as a way to reduce call time in having to look up multiple drugs for the member that they may be assisting on the phone. And so the key takeaway being the ability to save time with not having to enter all this information, because some beneficiaries may be taking many more than just 4 drugs with a complicated set of dosages and frequencies. And so this is one of those small things that can allow for a great amount of time savings and an optimized shopping experience. I had mentioned a couple slides ago the concept of pre-filling information. So again, another small thing that reduces the amount of time that either the member or the agent has to do things. And in this case, it's data entry of needed enrollment information. So because we have utilized preloaded information, we have the ability to automatically pre-populate the member's demographic information on the enrollment form. And in this particular image, you can see name, address, city, and whatever additional demographic information we have, such as phone number, email, we can populate that automatically to the enrollment form. So when that point in time comes to enroll, it becomes a much more optimized experience. So to quickly recap on the retention module, we feel that with the usage of a plan compare site, plus these preloading and pre-fill features that I just went through, it simply makes it easier for the member or the agent assisting the member to accomplish their needed shopping and enrollment needs. And with this combination of products and time-saving features, we believe that this will result in a positive impact to the carrier's retention efforts. Okay, switching gears a little bit, let's now talk about how we can support your ancillary products. Earlier, I spoke on this particular product, and I know Don has also highlighted ancillary products when he was going through Agent App. We are happy to offer it as well in the enhanced feature, as an enhanced feature in the user experience upgrade. Again, I've had the opportunity to meet and speak with clients, and I consider ancillary products and the support for these as an increase in trend in what I'm hearing from our existing clients. And as Don mentioned as well earlier, we are definitely in need of hearing what the business needs are. And this, I'm happy to say, is one of them that we can now support. If we have the ability to offer a one-stop shopping and enrollment experience now with the support of ancillary products. In addition to not only prominently being able to market ancillary products along with your Medicare health plan options, there is also the capability to have the enrollment for that integrated with the health plan enrollment. So let's take a quick look at how this appears in the user experience. Here's a preview of how ancillary products can be seen in the shopping cart. So I'm going to go ahead and walk us through the layout here. So you can see, starting at the top, that we have a health plan that's been selected. It's an MAPD plan with a $55 a month premium. Available with that particular health plan are a set of ancillary products for the beneficiary to choose from. We can see that we have a dental option, a vision option, as well as a dental and vision combination option. We can see that the beneficiary has the associated pricing so that they have a clear distinction between the premium for the health plan and then the additional premium for any of the ancillary products that they may be considering. We feel that this is an important aspect of the user experience so that they can truly consider and weigh in on their decision before entering into the enrollment, because once they click on that enroll button that you see there, we want to make sure that they can have a streamlined process where they complete that enrollment and don't fall out or have anything interrupt the actual enrollment experience. Well, I hope you have found our Medicare plan compare updates enlightening. This concludes the products walkthrough portion that we wanted to discuss with you all today. I'd like to go ahead and hand this back over to Don for a couple last items for us today.
Great. So as promised, we actually get to come to our survey that lets you choose the products that you think would be most valuable for us to pursue in the future. So you should now see a list of 5 different options to choose from, and I'll explain again what these are. The first one is a site before your plan compare site. So you have your plan compare site for shopping today, but we know that consumers need to go through a process before they get there, where they explore your brand and your plans. And so this is an ability for you to offer a site that makes for a seamless transition between all of the aspects of Medicare shopping and enrollment, not just the parts that we currently handle. The second one is a site after enrollment to help you engage your members and reduce the cost of healthcare. That can include things like our drug compare product and our retention module, and a variety of other features that really help engage your members after they become members. The third is broker co-branded sites, and that is something that would allow you to control your brand while also allowing the agent to have his or her own site so they can increase sales, and ultimately you'll increase sales. Fourth is lead generation and distribution. And fifth is a comprehensive provider search, including hospitals and quality measures. So on this last one, I know that everybody wants a physician search that applies to their own carrier. So when you answer comprehensive provider search, really just assume that we've already provided you with your network physician search. All right, go ahead and vote. Pick up to 2, please. Give it just a couple minutes more, a couple seconds, I guess. All right. It looks like we are ready to share the results. So comprehensive provider search is the clear winner with 60% of the votes coming to it, followed by lead generation and distribution, followed by engaging members after they've enrolled. So thank you guys very much, guys and gals and women and men. We really appreciate that kind of input on where we should head with our products in the future so that we can continue to provide things that are valuable for you. So at this point, I'll just do a quick recap there. Again, our newest products that can help you meet your goals include the UX upgrade for consumers, the Agent app for iPad, Plan Compare Plus for both call center and brokers, retention module, and of course, ancillary. I would like to close with a suggestion that you guys invite the product management team to your place of business. We really get a lot of value from listening to your needs. We can really evolve our products to best meet your needs if we really hear directly about your needs and explore those with you. We also like to learn from your brokers and observe your call center. So please don't hesitate to invite the product management team. We love to get engaged with you and improve our products to meet your needs. On behalf of Connecture, Christian and I would like to wish you all a successful AEP. Robin.
All right, thanks, Don. I do have a couple of questions, so go ahead and get started. I also, before we get started with the questions, Just want to reference that we have joining us as well Michael Adams and Ron Tantoy with the product department as well to assist with any of these questions related to our products. The first question is around preloading beneficiary information. So I'm assuming they're referring to the retention module, but they're interested in knowing how the beneficiary information is provided and then supported in the solution.
Yeah, this is Christian. I'll go ahead and take that one. So we can support the preloading of beneficiary information with a set of member and drug data file requirements. And so that is something that we can provide to the carrier so that they have a clear understanding of the required data, which is comprised in those two particular data files. And in order to support the information that the member and or agent would see relating to demographic information and drug information, we would expect to receive that particular set of data from the carrier.
Okay, great. The next question, is the agent app only available for iPad or can it be used with other tablets as well?
This is Don. I can take that one. The agent app for iPad is currently only for iPad. However, that is a great question. We have definitely heard interest over time in Android. Normally people ask and they seem like, yeah, do you have it? We don't really care if you do or not. We're just curious. But we are starting to hear more and more interest in the Android version, and therefore we do plan to roll out Android. We are looking at as early as the first quarter of next year to have an Android version available. Possibly even sooner for a test version, but Android we expect in Q1 availability, and eventually we would also be looking at supporting Windows tablets as well. Thanks, Robin.
Okay, great. The next question. For any of these new products, are we still able to purchase and implement, I guess implement's the keyword there, for this upcoming AEP?
This is Christian here. I'll go ahead and take that one. So we're in a very interesting time right now, given that we are now in the month of July and the advent of implementation season for this coming AEP is underway. So our client services teams are already working with our carrier clients to implement for this coming AEP. So it's not such a straightforward question to answer. There are a couple of intricacies that we would need to cover, but it essentially would boil down to what the product or feature is that you're interested in and where along the timeline of the current implementation and slotting efforts that our client services team has already conducted with the carrier. So it really does depend on the particular product need as well as where we are at in the upcoming implementation schedule. With that stated, I would recommend that the carrier, if that is the case, that you contact your account management representative to discuss further.
All right, thank you. And we have one last question. During the shopping experience, can the plans that are displayed be limited to those plans that enable the beneficiary to stay with their current providers?
Sure, I can take that one. So we list all plans that are available to the consumer. Our tool really enables users to find the plan that best fits their needs. So our tool is capable of linking out to a carrier's physician network if the consumer would like to confirm whether that provider is part of the network. We also, our understanding is that by CMS regulations, we are required to show all plans. We can take that back for compliance review, though, if for some reason we are mistaken in that assumption. And of course, that also depends on if we're on a single carrier or multi-carrier site. So.
Okay, great. Well, Thank you, everyone, for joining us. We certainly appreciate your time. This webinar has been recorded, so you will receive an email shortly with a link to this presentation so that you may view it again or pass it along to another person within your organization. If you would like to schedule a deep dive in terms of our products or a consultative strategy session with one of our Connecture thought leaders, please feel free to send us an email at marketing@connecture.com. Once again, thank you so much for joining us, and have a great day.